Hi, I'm attorney Gregory Dell, joined by attorney Cesar Gavidia, and we're going to talk about endocrine disorders and how they relate to long-term disability insurance claims. And Cesar, right off the bat, the challenging thing about endocrine disorders is the fact that they're chronic medical conditions that most people have been diagnosed with for probably months to years. They've been working with the condition for a while, and they reached a point where they just can't do it anymore, and that results in them filing for a disability claim. When someone comes to you with this type of scenario, what do you need to do in order to present their claim to get their benefits approved?
Sure. So, there are hundreds of thousands of millions of people with endocrine disorders, hormonal imbalances, and just because you're diagnosed with one of these conditions doesn't necessarily mean that you're disabled or that you are not able to function and work. It's really a matter of these conditions, like you said, being kind of in a chronic state and being in a state of such severity and really not even being able to be controlled much by way of medication management or whatever it is your doctors are trying to do for you to control it, to treat it, that those symptoms, the symptomology is really what creates the disability and that inability to function.
And in terms of documentation, and we're talking about thyroid disorder, parathyroid disorder, adrenal gland disorders, one of the biggest endocrine disorders that is probably one of the most chronic medical conditions is diabetes. And people treat for these, conditions for a while. How important is the medical documentation when the disability company is going to review the claim?
Yeah, documentation is really critical. The manner and the frequency in which you're presenting to your doctors, and particularly your specialists, who are really knowledgeable and are trained to treat these conditions, is what's important, because the disability insurer is going to review those records. They're going to see if there's a level of treatment and frequency that rises to the level of finding that there's a chronicity, a chronic nature to this condition, that there's a severity in these symptoms. If the records really don't reflect that, then it's going to be very difficult to get your disability claim approved, because like I said, there's millions of people with these disorders and many are working. So the disability insurer is going to automatically assume that that is the case for you. So how do you go about proving that? Really, it's by ensuring that you have the support of your doctors, and the way you get the support of your doctors is by basically the evidence and the objective proof within those records that they're recording, the complaints that you're providing to them, and of course the laboratory work that's coming back and showing that that things are chronic and not normal, that your hormones and that the level of this blood work is abnormal.
And Caesar, what about the side effects of medication? What role does that play? And again, what happens if the claimant isn't documenting that in the medical records?
So medication is really critical. You have to remember that sometimes this medication that you're prescribed, it's kind of a balancing act. It's a dance. The doctors are trying to figure out what is the perfect dosage and what is the perfect medication to treat your condition, to treat your symptoms, to get those hormones in balance. And I mean, it could be a variance in micrograms here that you're talking about. So it's really important to document and to tell your doctors how you're feeling. Sometimes you could be having certain episodes, heart palpitations, certain anxiety features, things that you've never really experienced before. And that could all be a matter of this medication, that it's not tuned right for you. So it's really important that you're speaking to your doctors frequently, that they're documenting if there is some adverse effect to this medication, whether it's working or not working, and if there's a need to change the medication, to change the dosage. Sometimes it's just a matter of going from a generic brand to the brand name medication. It's adjusting medication in micrograms here. So all of that is completely important. It comes down to the communication you're having with your specialist, with your treating doctor.
Another issue we talk about, which is a term that we often use, is comorbidity of your illnesses. Can you explain what that is and how important it is to present the total picture of what's going on from a medical standpoint?
Yeah, it's really important. What I tell people is if you're not documenting, then you probably should. You sometimes can be your own best historian. Some of these features, some of these symptoms, you may start having in the beginning of the month, and you may not see your doctor again for 4 or 5 weeks, or maybe even 2 or 3 months. And if you're not, documenting how you're feeling, if you're not documenting the symptoms and the frequency of certain strange things occurring, or feeling a certain way, whether it's a fatigue or whether it's certain pain or symptoms in your chest, or anything that you're feeling that's not normal, if that's not being documented, there's a strong chance that you may not remember it in a month or two. If it's not happening every day, if it's happening once every few weeks and it's not being documented, it may be something that you don't bring up 2 or 3 months from that point when you see your doctor and they ask you, how are you feeling? You're thinking of how you're feeling that week or the week before, and you're telling them, well, everything seems fine, everything seems okay. So you're not really doing yourself much justice there, because there's a period here of maybe 2 or 3 months that there have been things that have been going on that your doctor should know about, and the only way for you to know and to remember to express that to your doctor is by keeping a log and bringing that with you to your doctor's appointments.
Yeah, the log is a great idea because even if you just keep it for 30 days, when you look back at it, you'd be surprised how many times during the day, or maybe you have some good days and some bad days, but you really document what you're feeling, what's going on, what were the symptoms, what kind of cognitive complaints were you having? Were you having lightheadedness? Were you having fatigue? Were you having difficulty remembering things? And getting that in there, because those are all normal symptoms that people have when they have these types of endocrine disorders, or if they have flares, or if the medications go
Right.
off, and the imbalances go, they go up and down. So,
Right, and some of these things you may not even be thinking or associated, but there could be comorbidities, things that might not seem like they're related, but they're in fact a direct, they're a direct effect of something that's going on with an imbalance, or an adjustment that needs to be done to your medications.
often, Caesar, we also find when we talk about the comorbidity, we're talking about the comorbidity of other medical conditions. Whether you have a musculoskeletal issue, whether you're having neck problems, back problems, knee, hips, shoulder issues, or if you're having cardiac issues. And it's very important to present the total picture. So you have to let all of your doctors be aware of the total picture of what's going on. Especially, you talked about secondary, what we call mental nervous type conditions, where they're having anxiety or depression, secondary, not primary, but secondary to your endocrinological issues that you're suffering. And that becomes the total comorbidity package of presenting, look, it's not one, two, or three things, it's the totality of all of them that are making me unable to focus, unable to do my job. And often Cesar will even go a step further and present some neuropsychological testing to show that the person is being truthful, not exaggerating their symptoms, possibly showing also some cognitive limitations where they're not functioning at as high a level as they should be. For example, an executive should be functioning on a neuropsychological testing at the highest level of functioning, and they may come back at average. Well, for some people, average may be okay, but for a high-level executive or a doctor or a high-level business professional, they shouldn't be showing at average. And that is a functional limitation, which is preventing them from being able to work at the high level that's required of their job. So that's another tool of neuropsychological testing that can be recommended by a doctor, that is often performed in the forensic environment, which is what we get involved with when we're presenting a long-term disability claim. In summary, what we often do is we provide a free initial consultation to review your claim. No matter what stage you're at, we encourage you to call us, whether you're applying, whether you've been denied. We will review your policy, or we'll review your denial letter, and we'll let you know right away how we think we could help you. Our clients are located all over the country, so we're available to represent you no matter where you live. We encourage you to search our website, whether you search by your company, your occupation, or your medical condition. You're going to find a lot of helpful information that we've taken a lot of time to put together. That involves cases that we've resolved, lawsuits that we've summaried that may be cases similar to yours, reviews about your insurance company, or questions and answers that people have asked us and our lawyers have answered on our website. And the reason we really want you to have all this information is because we want you to be educated about this process, because the disability claim process is somewhat of a game, unfortunately, where you have to know how to play it in order to put yourself in the best position to get approved. And we want you to be as educated as possible so that you can be in the best place to get your benefits approved. So no matter where you live in the country, we look forward to the opportunity to speak with you, and we'll be here should you need us in the future.